Why do opioids increase pain sensitivity in sickle cell? Imagine taking medication to ease your pain, only to find that it sometimes makes your pain worse. That's what happens with opioids in some people with sickle cell disease. While opioids are often used to manage pain, they can paradoxically increase how sensitive you are to pain over time. This phenomenon is called opioid-induced hyperalgesia. It means that instead of just relieving pain, long-term or high-dose opioid use can make your nerves more responsive to painful stimuli. Several mechanisms explain why this happens in sickle cell disease. First, opioids like morphine work by binding to specific receptors, called mu-opioid receptors in your nervous system. But in sickle cell disease, morphine also activates other signaling pathways involving receptors like vascular endothelial growth factor, receptor to and platelet-derived growth factor receptor beta. These pathways are linked to increased tolerance to opioids and heightened pain sensitivity. Studies in animals show that blocking these pathways can reduce hyperalgesia, suggesting they play a key role. Another important factor involves toll-like receptor 4, or TLR4, in the brain and spinal cord. Morphine can interact with TLR4, which is part of your immune response. This interaction promotes neuroinflammation, a kind of inflammation in your nervous system, which can amplify pain signals and contribute to increased pain sensitivity. Opioids can also activate mast cells, immune cells that releases inflammatory chemicals. This activation can lead to more inflammation and pain, especially in sickle cell disease, where inflammation already plays a big role in causing pain episodes. On a peripheral level, opioids may worsen the properties of sickle red blood cells. They can affect the flexibility and structure of these cells, making vaso-occlusion, blockages in blood flow, more likely. This worsens tissue ischemia, or lack of blood supply, which is a major cause of pain in sickle cell disease. Additionally, people with sickle cell often need higher doses of opioids because their bodies clear these drugs faster and because their pain mechanisms are more complex. Using higher doses and taking opioids for longer can increase the risk of developing opioid-induced hyperalgesia. In summary, opioids can increase pain sensitivity in sickle cell disease through multiple pathways involving nerve receptors, immune responses, and blood cell behavior. This makes pain management tricky because opioids might sometimes make the pain worse instead of better. That's why healthcare providers often recommend careful use of opioids, close monitoring, and combining them with other treatments. Using a mix of medications and non-drug approaches can help reduce the amount of opioids needed and lower the risk of increased pain sensitivity. If you have sickle cell disease, it's important to work closely with your healthcare team to develop a personalized plan that balances pain relief with minimizing these risks. Always consult your doctor before making any changes to your pain management strategy.